So I will be talking about each mental illness and how to treat it. So first is Rabbit, who has general anxiety disorder, and the treatment for that is medication such as an SSRI, which is a selective serotonin reuptake inhibitor, as well as exercise, restful sleep, avoiding caffeine or other triggering substances, reading self-help books, looking to what makes you calm, so maybe tea, yoga, meditation, and also therapy. Next is the caterpillar, who has grandiose delusions. The treatment for that is medication like antipsychotics and mood stabilizers. Also CBT, which is cognitive behavioral therapy, and also looking for an underlying cause such as a brain tumor and treating that first. Then there's Alice, who has paranoid schizophrenia. The biggest thing for that would be medication such as antipsychotics, anti-anxiety, and antidepressants, and then also psychological therapy, support groups, counseling, and then electroconvulsive therapy, which is a therapy that uses electrical currents to change the chemicals within the brain. Next is Alice in Wonderland syndrome, and the first thing is to check if there is an underlying cause. Next is that there's really no treatment for it except for to make sure to stay calm and restful during episodes, and to remember that these symptoms that you're having aren't harmful, and also to, if you can, have someone there with you reminding you of those things. Then there's the Mad Hatter, who has bipolar, and medication for bipolar is, there's so many. So it's good to find the right concoction for bipolar to help you stabilize, but also while you're going through ups and downs, it's good to have a good daily routine and to stay organized and to write down all your thoughts. Because we're going through so many ups and downs, it's good to try and find stability in the things that you can control, as well as CBT therapy and counseling. He also has PTSD, which is post-traumatic stress disorder, and treatment is going to counseling and therapy and learning healthy coping mechanisms, as well as treating other problems related to traumatic experiences such as depression, anxiety, and the misuse of alcohol and drugs. Winnie has ADHD. Treatment for that is learning different social skills, going to support groups, and medication like Adderall. He also has OCD, so self-care like rest, eating nutritious foods, and avoiding high sugar foods, processed foods, alcohol, and caffeine. All of those can really trigger OCD, as well as going to therapy and taking antidepressants. Piglet has general anxiety disorder, so like I talked about before, exercise, restful sleep, therapy, looking to what calms you, so mostly just self-care as well as therapy and anti-anxieties. Rabbit has narcissism, which is kind of hard to treat because usually the person doesn't think that they have a problem, but if you can get them to go to therapy and realize they do have a problem, that's really big. Learning to relate with others so that their relationships can become more intimate, understanding and tolerating the impact of the issues related to your self-esteem is also really big. Eeyore has dysmic disorder, which is persistent depressive disorder. Treatment for it is identifying issues that contribute to your depression and changing behaviors that make it worse, identifying negative beliefs and behaviors and placing them with healthy and positive ones, finding ways to cope and solve problems, and also just going to therapy, getting on antidepressants. Owl has dyslexia, so the biggest thing would be getting a tutor to help with reading, helping understand and recognize the small sounds that make up words, and understand the letters and strings of letters that represents the sounds in words, as well as reading aloud to build fluency. Tigger has ADHD, so some treatment for that would be going to support groups, learning social skills, and medication like Adderall. Kanga has social anxiety, so treatment is pretty similar to general anxiety disorder, just psychotherapy and medication. Rue has autism, so medication would be for seizures, insomnia, and trouble focusing. Also trying to go to occupational therapy and applied behavior analysis. Lastly is Christopher Robin. He has schizophrenia. He's not paranoid, but he has hallucinations of the animals speaking. So antipsychotics and therapy and support groups, counseling, as well as going to the electroconvulsive therapy. I think that the psychology behind Disney movies is really cool, and it puts more of a spotlight on mental illness. And I think some big things for future action about mental illness would be having better mental health facilities. I just think that from personal experiences with family, there's not enough places to go besides the psych ward. And there needs to be more places to go when you're having a really, really hard time that's not the psych ward, filled with people who are not exactly even in a coherent state of mind, but with people who know what they're doing but are having a really hard time mentally. And I think that that really needs to be a big part that is state funded, because there are places like that but are extremely expensive. So I think our government should be working on that.